Good evening and welcome to another edition of Showtime TV. I'm your host, Omar Rashada. As many of you know, March is Women's History Month, and this is part two of me honoring women in the community. And today's topic of discussion is women in healthcare. And I have some distinguished, awesome guests this evening. I have Miss Rita Langraf from the University of Delaware. I have Miss Paulette Smith, who is from FASA. I have Oshay Johnson, who is a registered dietitian. I have Dr. Nadine Lindsay, who has her own private practice. Ladies, good evening, and thank you for being a guest on tonight's program.
Absolutely. Having us.
Okay, so what we're going to do, we're going to just allow you ladies to get a brief introduction of who you are and what is it that you do. So we're going to start off with Dr. Lindsay.
Okay. Good evening. Sorry, I was multitasking. I'm so sorry.
Yes, yes.
Yes, so good evening, everyone. My name is Nadine Lindsay. I'm Dr. Lindsay. I'm a family nurse practitioner. And I along with my business partner, we have a medical primary care practice here in Wilmington. We're on Lancaster Avenue. Been in healthcare for quite some time. I've worked at every level of healthcare. It's very fulfilling, and I absolutely love what I do. And currently we focus a lot on the underserved population. We met through our affinity for the underserved population, my business partner and I. And so we decided that we were going to come together to create a space here in Wilmington that the patients could come and feel free to sit and have a chit chat and smile and ask the questions that they need to ask in a completely non-judgmental atmosphere. Again, the goal is to create that space where patients are free to, ask questions and relax when they come in and not feel tense and return without getting questions unanswered. So here we are. I am here today, and I'm happy to be a part of this platform. Thank you.
You're welcome. Awesome. Okay, Oshay.
Yeah, so my name's Oshay Johnson. I am currently a pediatric registered dietitian with the Children's Hospital of Philadelphia. Prior to that, I worked as a nutritionist for the WIC program. So I've been involved in nutrition for quite some time. Right now, I'm mainly working with children with feeding difficulties and feeding disorders. I work with a multidisciplinary team. So I work with physicians, nurse practitioners, speech therapists, occupational therapists, psychologists, to help come up with the best plan to help some of our kids with feeding problems.
That's awesome. Okay, Miss Smith.
Yes, thank you. And thank you so much, everyone, for joining us. This is really a great opportunity and we really appreciate it. I'm Paulette Smith. I'm the founder of an organization called Friends of Zane Adams. We call it FASA. And FASA started, as many nonprofits do, with a family tragedy. We lost our granddaughter to postpartum depression. She had a 1-month-old son. And that's been 3 years. But for a while, we simply we were trying to take care of Zane, and we realized that a lot was going on with postpartum depression that people were not aware of. And so we formed FASA for 3 basic reasons. Number one, awareness, because we were clueless. I had not heard the term myself, even though I'm a mother of 3. I brought 3 children into the world and have 6. I never really understood or heard the term postpartum depression, didn't understand it. And so awareness was the first thing. Second, we wanted to just make sure that we put together resources. We're not doctors, we're not clinicians, we're not therapists or medical professionals. We try to make sure that our clients take that as their first route, but we try to make sure that in the pandemic, with the gap that occurred with businesses closing and different kinds of resources going down, that we became a connected dots organization. So we try to make sure that resources are available. So glad to be here with so many professionals. Got 3 new connections, whether you want to be or not, you're already in. But and finally, the third is to support the children who are left behind with educational scholarships. So that's FASA.
Okay, Miss Rita.
Thank you. And it's truly an honor to be here with all of you and the tremendous work that you are doing in the community. I'm Rita Langraf, and I'm at the University of Delaware. I'm in the College of Health Sciences, and I'm also the director for the Partnership for Healthy Communities that really is established to look at communities in Delaware who have been made marginalized, who have oppression, and to also go beyond, even though we know the value of healthcare and clinical medical care, but also to look at those drivers of health, that what we call the social determinants of health. It does make a difference where you live, what you have access to, including healthcare. Dr. Lindsay, so happy that you are bringing healthcare to those underserved, unserved communities. But we also know that these communities are impacted by other things such as access to quality education, access to employment, access to healthy foods, and many times, the risk behaviors that are associated with these types of communities are, tobacco outlets on every corner, access to alcohol. And we know that, that plays such a role in the quality of individuals' life. And so really thinking about this from a broader perspective, from health overall, do all populations have an opportunity to achieve optimal health? It's a World Health Organization definition. And, we see this around the world, but my work is actually really focused on Delaware communities. I served under Governor Markell as the cabinet secretary for the Department of Health and Social Services. So definitely saw the inequities that people face within our state, and was very fortunate when I came to the university to be able to carry that mission forward at a university level and really engage the university more intentionally in the community. In the College of Health Sciences, we do work with the communities themselves, largely in the city of Wilmington, to take our dietitians, to take our nursing students out into the community so they can get an appreciation that sometimes health looks different depending on the geography that you are living in.
Right.
So thank you for having me.
Definitely, no problem. When I was thinking about this program tonight, one of the issues that I wanted to address is the overweight issue. We talked about the unprivileged communities. For example, in the inner city, I'm in Wilmington, Delaware, and it's quite the same probably in other inner city communities as well. There's a lot of fast food places in the community. I rarely see any fruit and vegetable stores. Outside, they got one on Governor Prince. That's the only one that I'm aware of. So in terms of the African American community, is it that we're just eating too much fast foods, or are we not exercising? Ms. Rita mentioned in liquor stores, in the African American community, you got liquor stores about every 2 or 3 blocks. So you drink a lot of beer, that results in fat bellies. So, oh wow. So what is the direct correlation exactly as to why, particularly in the African American community, where overweight, obesity is pretty large? Anyone can address that.
I don't mind going first.
Okay, go ahead.
I think there are multiple reasons why, particularly I think in the African American community, like why obesity and being overweight is so prevalent. I think the number one thing is lack of education. I think a lot of people are interested in being healthy and they want to eat healthy, but we're not educated. I think in terms of how I grew up, I really didn't get any nutrition knowledge until I went to college and became a dietitian and started to learn about it. So I think that's a big factor, is people just aren't educated. I think another thing, access. You're absolutely right. If you live in an area where I don't have access to fresh fruits and vegetables, and all I have is a McDonald's and a liquor store, that's where I'm going to go eat because I don't know anything differently. I may not have a car to go to the nearest farmer's market, or even if I have transportation such as the bus, am I going to carry all of these bags with me on a bus back to my apartment? Likely no, I'm not going to do that. I also think, culturally, it's not and I'm just going to bring my family as an example. We think my family thinks you look better if you have more meat on your body. So the heavier you are, we consider you more healthy. And that's not necessarily always the case. So I think within our community, education is a big factor. I think access to healthy foods is a big factor. And I think, honestly, it's been in our culture. So I think a lot of times you have aunts, you have grandmas, you have family members who are telling you, you look better when you are chunkier, essentially. So I think those are the big three things. And of course, feel free to jump in if there are other things you ladies think of.
So Dr. Lindsay, how do you educate your patients, about those who come in overweight? So, I mean, what are you educating them on? Are you encouraging them to walk more? Are you encouraging them to eat more fruits and vegetables? What exactly are you doing?
So with my capacity that I work in, a lot of times, a lot of thought has to go into the teaching that you give, right? Or the instructions that you provide. Ms. Johnson nailed it, lack of access, right? So I have to think, where does my patient live, right? And with lack of access directly comes affordability, right? Are they able to afford it? Because as a clinician, I can sit in my white coat all I want to, and I can tell the patients you need to eat fruits and vegetables and all that. But if they don't have the resources to acquire the healthy foods, then what do we do? Right. And so these are questions, because for decades we've been drumming it home, right? Eating healthy. But the reality is, and Ms. Langraf said it earlier, social determinants of health. Where are you? Where do you live? What do you have access to? What can you afford? And so one of the things that I do is I try to meet my patients where they are. And let me use foods. Where do you live? What do you have in your neighborhood? Okay, where can you go? How might you be able to afford the things you need, right? And so what we do here as my practice, we try to locate areas that might have access to, like, I know Henrietta Johnson, like they have like a system where they have like food set up and you can just walk in and pick up. So we try to create those mediums. So we have little sheets printed out, and we'll tell our patients, this is where you can get that. This is how you might be able to eliminate that. And now for someone with canned foods, how do you tell them, don't buy the canned foods at Walmart? Well, that's what they can afford. They're on a fixed income. How do you do it? Well, maybe if you use some warm water to like kind of try to eliminate some of the salt until you can go to the greengrocer to buy something, that might help the situation. And so it takes a lot of work in terms of trying to meet these patients where they are, because we, for so long, we tell people to do this, but how do they do it? And these things are not being addressed. And so we find ourselves with the challenge of having to say, okay, this is how we might do that. Now, let me pivot a little bit to exercise, right? The American Heart Association is saying what? I think that's at 75 minutes, like 3 times a week. No, that might not be very practical. Let's be real. People have busy lives. How many of us have to work 2 and 3 jobs? That's what I did when I was going to grad school. I was in grad school as a single mother working 2 and 3 jobs, right? And so what I say to them, okay, can we start with 1 day, right? We meet them where they are, but it's difficult for me. I think it's a challenge to we need you to do 150 minutes a week and 150 minutes per week. And no, I start with my patients. So what I do, I say to them, okay, how about we do Thursday evenings? Let me know what day you have time on your hands. So let's start with Thursday. And the next visit, they show up and I negotiate with them, because again, for me as a care provider, these decisions become shared decisions, right? I'm not in the habit of telling people what to do, because you tell them what to do, but you don't put things in place for them to do what they're supposed to do. And so they won't do it at all. And so for me, it is it's like a work in progress. We constantly toss things around in this practice. But at the end of the day, the goal is to help the patient get healthier. So like I said, what we do when it comes on to certain things, we have shared decision making. We let the patient play an integral role, give them the opportunity to call us back and ask us questions if they need to. And again, we try to find resources that are available for these individuals.
And just to follow up, Dr. Lindsay, you said exercise. A lot of times when we think exercise, we think about going to the gym. However, there are exercises you can do right at home. I mean, you can do sit-ups. I mean, you can walk around the corner. So just because you might not have the finances or accessibility to go to a gym, I mean, do you encourage your clients to exercise at home or in their own neighborhood?
Absolutely.
Okay. Okay, Ms. Rita, do you have anything to add, or Ms. Smith?
And I believe what has been said is spot on. And I do want to say, it's so wonderful to have a dietitian and a nurse practitioner because it's holistic health, right? It's looking at everything that contributes to our health and our well-being. And Dr. Lindsay, when you were talking about meeting people where they are, how powerful that is, because it's really understanding what that patient is bringing into the office without judgment, without blame, and really looking at what surrounds that individual, because sometimes we take that for granted. And even our students in health promotion, I always tell them, don't assume that everybody has the same access or understands the same without actually showing some empathy and putting yourself in their shoes. What Ms. Smith does, through her personal tragedy, to be able to put herself in other people's shoes to actually work with families who are going through a similar process. That's the power of the human spirit. And Dr. Lindsay, it sounds to me that you really take the time, and I do find nurse practitioners do that, take the time to really understand the individuals, and not only with the burden of disease they may have, but the root cause and what is surrounding them. So I just applaud everybody in this room because you come from that spirit. And I think to heal our society and individuals who don't have the same level playing field as I do as a white woman of privilege, really, I just want to applaud everything I'm hearing because it really shows the gift of the human spirit.
Wow, very powerful. I just want to add another aspect, so to speak. Everything that everyone has said is so powerful. Now think of that for a mom, and not just moms, of course, have experiences of postpartum depression. Any foster mom or stepmom or anyone that's in the birth process, however it comes to them, and whether the child lives or dies, could experience that. But just think of that mom and the moms that we speak to every day. We have the pendulum. We have one side that's so concerned that she's gained so much weight and she hates her body. And she's never going to be the same again. And things are never going to be normal again. And she's just, the lowest part of her life is looking in the mirror. And then you have the mom or the mother who may not be struggling with her weight, but she's struggling with trying to meet someone like Oshay. She's trying to meet someone who could tell her what to eat. She's nursing her child, and she knows she can't eat everything. She knows everything is not healthy for her. She, of course, is going to go to her doctor. So many moms come to us and say, I don't think that they're taking me seriously. And so Dr. Lindsay is someone, she's created that safe space for people to come in and feel like someone's taking them seriously. One of the things postpartum moms that don't come forward and don't speak and don't ask about things say is that they don't necessarily feel safe. They don't know the questions to ask, and they don't know that they're being welcomed to ask. We have service in our organization called the Plaza Finder. And we know that a mom may not just be in stress because of her baby. She might be having stress because she doesn't know where to get the best foods from. She might be having stress because she can't pay her mortgage or whatever. And so with Deposit Finder, we don't take any personal or sensitive information. We just take a zip code and her contact information. We have a software application that can help us find up to 60 resources within 10 miles of a specific zip code. So we look at that. Is she asking about food? Is she concerned about her self-image? But where obesity is concerned, so many of you said just the right thing, especially Oshay, when you say, well, you know, women of color, they often feel I was a small person coming up, and I could have rang, I don't know the singer's name that made the song Boney Baroni or whatever, but I could have rang his neck. I could have, whoever he was, I could have choked him out because I was just very, very skinny. And it was like a tragedy. It was like, oh, I was just lower than a lower citizen. So I actually took a medicine to help me gain weight. I was perfectly healthy. So it's not just obesity that we deal with, it's also the other angle, and we're trying to balance. And FASA does. We get with, and so happy to have met all of you, but we get with nutritionalists. We get with people who want to tell moms and everyone what's good for their body without them feeling like they have to give up everything they really, really love in order to be healthy.
You know, Oshay, I want to go back to you just for a moment. Ms. Smith mentioned that she used to be slimmer, if you will.
Yeah.
There are those in their teens and the 20s who are very slim. They can eat popcorn, they can eat McDonald's, gain no weight, right? So 10, 15 years later, they eat McDonald's, they eat popcorn, chips, all that good stuff, cookies, and then they end up gaining weight. Now, what is it about our bodies where when you maybe in your late teens and early 20s or in your 20s where you can eat all you want and gain no weight, but when you hit 30 and 40 years old, the weight comes on. And sometimes it could be before that. So tell us, educate us.
Yeah, I think the biggest thing that plays a role in that is your metabolism changes as you age. So the older you get, the slower your metabolism is going to get. So one thing I also like to tell people who are young, they're in their 20s, you know, they have a super high metabolism, is just because you're young right now and you can eat whatever you want right now, that's not going to be the case 10, 15 years from now. So I think helping people develop healthy eating behaviors when they're younger is very important, which is why I love pediatric nutrition, because it's not necessarily just the child I'm working with. I'm also working with the family too, because these are kids. They're not cooking for themselves. They're not going out to the store buying foods. So it really is a family-based approach in terms of, yes, I'm doing this nutrition for your child, but essentially I'm helping the family too. But I think going back to that, metabolism is the biggest thing. So I think people being educated before they get to the age of 30, 40 years old about proper nutrition, about physical activity. And you're right, you don't have to go to a gym. I don't like going to the gym. Like, I love working out at my house. I like walking around my neighborhood. I like just being out in nature. I will walk up a flight of steps, and that's exercise. Cleaning my house, vacuuming. I sweat when I do that. So I think just giving people, like Dr. Lindsay said, realistic goals, meeting people where they are, because absolutely, I can tell you all day, you need to eat fruits and vegetables, but if mentally you got 1,000 other things on your mind that have nothing to do with your health, it really doesn't matter what I say, because you're likely not going to listen to me. So I think creating realistic goals for people, and also telling people too, I think a lot of times people come to see me and they want to tell me things that I want to hear. I don't want to hear that. I want you to tell me the truth. Like, I want you to tell me that you're not going to do this right now, and that's okay. Because you know what? We can work on those small steps and eventually make them bigger steps so that we're reaching those attainable goals, that we're reaching those goals that we want to ultimately reach, but kind of taking it in like smaller steps, I think, is important too.
Right. I want to go back to Mrs. Smith. FASA. What are the age population of females that you generally work with? Is it early 20s? Is it 30s? Is it 40s? Is it all ages? Or is there one particular age that's more effective than the others that you serve?
That's a very good question. But as you say, 20s, 30s, 40s. So we're talking about anyone who basically the women who could be postpartum. So we're talking about childbirth years. But like I said, we're also talking about men, and we're also talking about people who just might be in a situation with a child. And we're also talking about women who have had children. I was just talking with a mother today who didn't have her first postpartum experience until her third child. And she was just as kind of thrown by it. I speak to clinicians who have had postpartum experiences, and they needed counseling and a clinician, and they didn't go right away. So a lot of it has to do with what we say: stop the silence, stop the stigma. And of course, we want to try to stop the suicides, but we have to try to stop the silence and stigma that goes along with, oh, I might have a mental issue. Mental health, and as when I was on your last show, and of course, Johnny Gathers and I have stayed in contact. Thank you so much for him and his every Friday, his words of gold and wisdom on mental health. If you're not mentally healthy, you're not healthy. You can look wonderful. And of course, we know this from what's happening in our world today with people that we see that we believe have what we have determined as everything. They look good. They have every kind of access to every car, every high level of socioeconomic benefit that they can have, and yet they take their life. So we know that mental health is a part of the 100% health issue. Food, definitely. You are what you eat. You are what you eat and what you drink. I have to have a little drink of water now. But to answer your question, yes, we look at the entire population, and we don't just look at the moms. We look at the caregivers. Our messages, our last podcast was actually for caregivers and people around postpartum moms, because when you're postpartum, we have an advantage in helping, and I say moms use that language because that's who we basically deal with, but we have an opportunity to help them that many healthcare providers do not have. If you see a person, and we were talking about food, and they might be, you think they're overweight because sometimes people are built differently. I don't know if they're overweight just because they're larger than I am. But when you see a pregnant woman, then you know at some point she's going to be postpartum. Whether she is blessed enough to have her healthy child and a healthy life, or whether things don't go well for her, she's going to have a postpartum period. And that period can last anywhere from before she actually gives birth to her child until well after the child's second birthday. And like I said, some mothers have postpartum experiences after 2 or 3 children. And not every mother has a postpartum depression experience, but every mother has a postpartum period in their life that we, as their surrounding, back in the day, way back in the day when there was a village, that's what the village did. The village watched out for everyone. Everyone in the village knew when someone was having a baby, and everyone in the village was there. And we want to try to build that. We have such a great community online and in our churches and in our communities. And Dr. Lindsay's growing a community, Oshay's growing a community, Professor Langraf growing a community. We want to try to put those communities together and stop that I'm alone type of feeling. So it really doesn't matter about the age.
Yeah, I want to come back to postpartum depression later on during the program. Ms. Rita, your place of employment, University of Delaware, had partnership with the National Coalition of 100 Black Women in terms of a Black Girl study. Can you elaborate what's that about?
Yes, yes. So the Coalition of 100 Black Women, of course, is an advocacy organization. And several years ago, they did a study, not to the level of research that this current study embarked upon, but it was called the State of the Union of Black Women. And again, looking at, the here and now, the current State of the Union of Black Women. And then they wanted to venture forth to look at the State of the Union of Black girls here in Delaware. So they approached me in the partnership to find researchers that would be interested in actually embarking upon this study. And at the university, we put out a call to see if there were researchers already looking at this as their area of expertise. And interesting enough, there are several studies on Black men and Black boys, but they're across the country, but not very many focused on Black girls. And in order to be a Black woman, you have to be a Black girl first. And, as I think about what Ms. Smith is saying, what factors come into play, or as we talk about body image. And so what we found from this study, we actually started the study pre-pandemic. And then when the pandemic hit, we had to turn things over. And so it took us longer, but the girls' voices were so powerful, what we have learned from our Black girls. And when I was listening to you talk about weight and how girls, really look at their own self-image, the study was focused on 10 to 19-year-old girls here in Delaware. And I just want to read to you 68% of our Black girls at some time are really worried about their appearance. And, that self-image. And I think when we even talk about, depression and I wonder how the findings would have been pre-pandemic compared to pandemic because of the level of isolation that all of us felt, but also especially, children and adolescents. It's such an important developmental milestone, and that impact of many times being isolated, as Ms. Smith said about, the villages and taking the village, and how do we come back to that? Another profound statement that we heard from the girls were about 58% thought that their voices are not being heard within their own communities, not being heard within their schools, and some of them not being heard within their families. How do we take that information and think about how do we translate that into practice, that we lift up these voices of our Black girls in particular as we looked at this study?
Yeah, and I saw the video that one of your coworkers sent, and I had no idea that there was a summit. So is this going to be like an ongoing thing, or is this just a once a year annual thing?
So I'm really excited about this, and we talked about this, and I'm just so honored to be a part of it. That we didn't research for research's sake is a gift in of itself, right? But really what we want to be able to do is look at these findings and then translate that into practice to change that. I mean, that's why the coalition really wanted to venture forth in a really deep-rooted research project. They now are embracing how do we address these issues? And the one thing that we do want to be able to do in the Division of Public Health, they have a Bureau of Health Equity, but it doesn't have resources. Right. So, a bureau without resources, it's going to be very difficult for us to trend towards equity. So the coalition is actively advocating right now with the legislative branch to really staff up that bureau. And and look at each of Delaware's counties, because some of the information we got from the Black girls was different depending on what county you lived in. And so then how do we really get more intentional at that community-based level, as we're all talking about, and even bringing back, as you know, my vision for villages, right, where everybody actually does know each other, and how we support each other, whether it's through, you know, whether somebody is facing a physical level of illness, or whether emotionally they're struggling, you know, because I think even when we look at the professionals, you know, in primary care, we have a shortage here in Delaware, and behavioral health, we have a shortage here in Delaware. So how do we allow people to practice at the highest level of their license while also creating this vision of this going back to a village where we're all supporting each other? And I believe listening to these Black girls really like drove that home, of what the possibilities are. And then when I think about, you know, healthy mothers, healthy babies, you know, health starts at preconception, but many times we don't focus on that, and then it profiles in a way, you know, during childbirth or even during labor, in a way that might not provide the mother with the healthiest of circumstances.
Right. I want to go ahead, Ms. Smith. Go ahead.
I just wanted to just pop something right in there while Professor Langraf was talking about advocacy and about a higher level of how we can bring things together. Because I was going to mention this. I have all professionals on with me, and tomorrow, FASA will be participating in the 2022 Advocacy for Mental Health virtual. You have that. I don't know if any of you are being involved in that, but that's something that really pulls things together. Now, of course, the focus will be for postpartum moms, but funding is so important. And when you see some of the figures, and I'm not going to go into them here, I mean, you go out to FASAinc.org, and I'll have some information out there. FASA will be participating as online community advocacy, because that's that village thing that we try to bring in. But the numbers are triple when it comes to getting care, getting help for women of color, Black and brown women. They are less likely to ask for help, access, as many, as Dr. Lindsay has said, as you all have said, access, but also trust. Like, I shouldn't even ask because I know it's not going to happen. This was not Christina's issue. This was not our baby's issue, but we know that it exists. And we know that even if it's not just because of embarrassment or just because of shame or whatever, if it's because of lack of income, if it's because of lack of transportation, if it's because of just lack of food, energy, childcare, not being able to take care of the other children, whatever reason you're not getting that health care, a lot of it is because of what Professor Langraf said. No one's going to reach out to you. You're kind of out there struggling, trying to figure it out. And that's what I just wanted to say. And I'm going to say it again before I leave, give you some information about going over there. Tomorrow, the virtual conference will be with 33 senators, and they'll be working with policymakers to improve mental health around the country, Delaware included.
Awesome, awesome. Ms. Reed, I want to go back to you because you mentioned the word self-image. I was wondering if you have in front of you, or if it was talked about in terms of the Black girls in particular, in terms of their self-image. Did any of them face issues of colorism, meaning that they were put down because they were too dark-skinned or because they were dark-skinned? And then also, my second part of the question is, did any of them address the issue of bullying? Because Ms. Smith mentioned mental health, and bullying results in verbal abuse, emotional abuse. As a matter of fact, it even results in suicide, because you have teens and young children who committed suicide because they were, being bullied online or being bullied in school.
And I think yes, and I do. It's interesting, that you brought up also the color of one's skin and how people are viewed, even in the community relative to the light, brown versus the darker skin and the bias that's associated with that. And the girls also talked about bullying to the extent of racism. And that's where we saw the impact of that. I can share with you too, I have the honor of teaching community and public health at Great Oaks Charter School, which is predominantly Black and Brown students in that charter school as well. And what I see in the girls too, I think, Omar, what you're saying too, relative to bullying, what I'm actually seeing is a heightened expression of anger and even fighting one another that, well, I'm an older person, but I don't recall the level of girls being engaged relative to that. And I do wonder, because of our social isolation, how do we get back to actually working to resolve conflict in a way that it's not impulsive to the degree that that anger just comes forward and out. And seeing in girls engaged in that, one girl in my class in particular, she took total accountability for triggering an incident, and I was quite proud that she felt empowered to take her own accountability. But wouldn't it have been wonderful if we were able to resolve that before there was a physical altercation to that degree? Because again, I don't recall this level of heightened emotion where it's almost sometimes that they can't just resolve that. And again, I take that back without really researching it. Was there, due to the pandemic, a level of social isolation, a pent-upness, if you will, that, how do we communicate in person again? How do we get comfortable with each other from that particular aspect that used to be natural for us? How do we, reacquaint ourselves? Because humans need to be connected. Mm-hmm. I mean, it's wonderful, this technology that affords us the ability, and at one point early in the pandemic, that we could stay connected. But if that's the only way that our connection is, that, and the one thing that the girls talked about too is, and bringing up bullying, is our devices, is social media. To some extent, growing up as a girl, I didn't have those distractions. So if there was bullying going on, it was minimal compared to what you see now on social media. And the girls recognize that. It also has impacted their sleep patterns. So, sometimes we do not know the value of sleep to the degree that it is, especially in our adolescents. They really do require, at least 9 hours of sleep. And many of the girls were taking their phones to bed and then they weren't sleeping.
Okay, Ms. Rita mentioned the pandemic. Dr. Lindsay, I'm going to ask you a question about the pandemic. Let me give you a scenario. John Smith has the COVID-19. He isolates himself, quarantines himself for about 7 to 10 days, goes back, get tested. He's negative. He had no symptoms, feels good, maybe a little cough and a sneeze here and there, but that was it. Todd Smith has COVID, same age, same weight, same height, etc. He catches COVID, he gets real sick. He's in the hospital for about 3 months. He gets tested positive. Another 3 months, he's still in the hospital, gets tested, he's negative, he starts to feel better. So what is it that one person can have COVID and they can self-quarantine for about a week or two and they feel okay, and the other person may have it, and then they're in the hospital for about 3-4 months, might even be on life support?
So that's an interesting question. Thank you so much. So let me say this. I'm going to use a simple term. It's all about the immune system. And because our immune system is unique to each of us, we are built differently. We might have comorbidities, underlying comorbidities that sometimes are not even identified. And so for those reasons, that second individual winds up in the hospital, winds up getting all these, this additional treatment. And I'm gonna just use diabetes as a large percentage of the people walking around with diabetes don't know they have it, right? And so that individual was never diagnosed, right? He gets COVID. He's literally, he has underlying conditions. So his immune system is going to respond to COVID absolutely differently than the other person who does not. And so it becomes so important that we are getting our regular checkups, that we're ensuring that our health, we understand our health, we know what's going on with our health, right? Because if we know, we can prevent the thing from happening, right? As opposed to having to cure the situation because we are walking around with it and we absolutely have no idea. So again, it goes back to self-care. And with that comes a lot of, especially in the marginalized communities, what we find is a lot of time individuals don't seek care, right? They don't seek care because they go to their clinicians and they feel less than, or they don't feel that their questions were answered, or they think it just doesn't matter because I called, like one patient told me today, she said, I've been calling my office for, I don't know, 3 weeks and nobody responded, right? And so if you're calling your practitioner's office and you are not getting a response, you are gonna feel like, you are left behind. So why bother? And you'll find largely that these individuals will just go back, go about their normal day, and before you know it, one day without care turn to weeks, the weeks turn to months, the months turn into years, and it's 5-6 years, right? And so much could be going on with that individual. And yet you're walking around and you look okay and you think you're okay, but you're really not. And so back to where I began, your immune system is not really it's really not intact. It's not connecting with you. And so I was an example of that, right? 2020 December, my business partner and I, we had our project going and I was very stressed, right? I am the partner that get roused up when things are not going right. We're two females, we're trying to do, this project, and I'm very stressed. And I came down with COVID. And I was ill to the point where I would go to bed at night wondering if I was gonna get up the next day. However, my 68-year-old mom that I infected, she coughed for 2 days, just coughed for 2 days. And so here we are. My immune response was just not there because I was very stressed. I was fatigued, right? And so even the things like stress that we think we take for granted on a daily basis, it affects our entire existence. And so we all have to be mindful that it is really essential to get ourselves checked, be open and honest about what we're going through, get the professionals to deal with it. I think we need to begin to pull our marginalized community members, and some are not in marginalized communities, some are in the other communities as well. Stereotyping, mental health, right? Ms. Smith talked about, mental health earlier. So many people don't want to tap into that because there's a stigma attached to mental health. And so we all need to, it takes everyone in the community Ms. Smith talked about, right? We need to begin to rebuild those communities where that individual feels free and they are in that space that is provided for, that would provide that safety and that openness and that listening ear where they can talk about the issues and it affects them.
Right. You know, Dr. Lindsay, I received, so many others have received all 3 vaccine shots. Do you foresee us getting a shot every year? I was thinking about that, you know.
I think Pfizer is recommending a 4th, so we'll see what will happen. I kind of will hold on to what but I know there's a 4th being recommended by Pfizer. What I will say is that since you brought the vaccine up, but one of the things that I will appeal to individuals is that let us research this for ourselves. Let us look into it. Let us take one of the things about my patients when they asked me about the vaccine, I said, what do you think? Because I am also a consumer, right? So give me your thoughts on it, right? We know we can protect ourselves and those around us. We can minimize you know, the ability of the virus to make us very ill. You know, let us just think about it carefully and make the right choice, not just for us, but for the grandmothers and the babies that are around. Let us as humans just think about what we're doing again, and just tap into that humanness inside of you, and let us protect ourselves as well as those around us. We know a lot of people say to me, I don't know what's in it. And the question I like to ask, and I'm throwing this out to all your listeners tonight. Well, I don't know what's in my soap, but I take a shower every day. And I don't know what's in my cereal, but I'm glad to have some in the mornings.
And let's grow your own and make your own.
Yeah, I get it a lot, so I throw it out. Do you know what's in your soap? No. Okay, do you know what's in your cereal? No. Well, do you know what's in the mashed potato you eat when you go to the store? No, then okay then, but you eat it, right? So I just try to throw that out when I have and I'm throwing it out to your listeners tonight. Let us look at it from that perspective.
Oshay, working at the Children's Hospital, do you see a high number of cases or any type of cases of COVID?
We haven't seen a large spike of COVID in the pediatric population. I think there was a big surge around December with the Omicron variant. But I would say most of the kids that are getting COVID, the majority of them are asymptomatic. I would say the kids that are having more symptoms with COVID, they also have other comorbidities. So I would say I would say we're actually seeing more like RSV in the hospital than we are positive COVID cases.
Okay. And going back to nutrition with the kids, you know, parents are driving their kids to the community. On the right-hand side, there's a McDonald's. On the left-hand side is a Burger King. Kids love fast foods. They love the Happy Meals. So how do parents educate their kids in terms of trying to eat more healthy meals? Because let's face it, we're all kids, we all like the hamburgers, the cheeseburgers, the fries, and the fried chicken and all that good stuff.
Yeah, I like those things sometimes too. One thing I try to teach my parents is everything in moderation. I'm not a person who follows a particular diet. I don't think they work. So I think, you know, I kind of go with the notion of, you know, this is what I think your plate should look like every day. So even if that means that sometimes you're busy and you know what, McDonald's is the easiest and the fastest thing to do. Your kid went to school, you went to work, kids have practices, you have homework. What I would tell my families is that if that is something that you have to do because of convenience, then I'm going to say, you know, go for the healthier option. So if the store has a grilled chicken nugget versus, you know, a breaded chicken nugget, go with that. Or go with a grilled chicken sandwich versus a cheeseburger. Or for your kids, instead of doing French fries, do the apple slices. Instead of doing juice, do milk. So what I try to do is I'm not going to take anything away from you because realistically, you're not going to do that. But what I do try to do is get to the level of my families, get to the level of my kids, and try to make those appropriate swaps. And also tell them too, guess what? I like to have French fries sometimes too. I like to have pizza sometimes too. If someone told me I would never eat those foods, I would not listen to you because I'm going to eat them. However, I don't eat French fries every day. I don't eat pizza every day. So it is something that is like a treat to me. Other things I tell families too, you know, those things that you like to eat out, you like to eat pizza, you like to eat cheeseburgers, make it at home because you know exactly what's going in that. You can change what type of meat you eat or what type of meat you use. You can change whether you bake the French fries or you fry the French fries. So I also try to tell families too, you know, those foods that you love to eat out, make it at home. And guess what? It's cheaper when you eat it at home too. So there's also that cost benefit that goes into that as well too.
Right, right. Smith, I want to go back to you. You know, like you, postpartum depression. I've never even heard of that term until I had you on the previous show. And I was thinking, does the depression have to necessarily come after the birth? For example, could a mother be depressed prior to the birth? I mean, maybe there are things going on in her life that, you know, she may already be depressed before she even have the baby. I mean, how often do you see those cases, if any?
Well, absolutely. I've learned so much. We never saw what we knew to be depression in Christina, but sometimes people are more obvious with their symptoms. But what I've learned is that I've learned what Dr. Lindsay said. Everyone is unique. And what was being called baby blues, for many years, there was a term called baby blues. And it was very understandable because like I said, I'm a mom, and you are you're expected to be, this is the happiest time in your life. Nothing better since sliced bread. You are just you're at your peak. You all know that our childbearing years that's life. You're living. You know that because you're producing life. And so what's wrong with you? Especially the moms who might not have an instant bond with their babies. Sometimes just the activities that are going on around the moms can trigger previous traumas, can trigger previous bad things that might have happened or things that they didn't like. In our podcast, in our list of podcasts that the plaza produces once a month, we have a hypnotist who came in, and because as Professor Langraf said, we believe in the holistic approach. We understand that the medical doctors did not go through medical school and take all of their training in order to provide a patient with a holistic solution. But many of our medical doctors team up with holistic solutions and with nutritionists and with dietitians, because they know what's necessary, but they don't go into that particular skill set. And so when the right mom gets with the right resource, that resource is going to take the time to find out about her past. There's a reason why you just don't feel like you're close to your baby, but it might not all be mental. There could be something physically going on. Maybe you're not getting enough sleep. Maybe you're not eating the right things. And it's so intricate until the question you ask is a great question, and the right people, the counselors, the therapists, that's what they get to. Also, like I said, remember there are moms who have had joyous times with their 2 or 3 babies. I had a mom who was at her 4th child, and that's a big struggle because after you've had 3 children, you're not expecting to go downhill from there. You actually think you know what you're doing. You actually think you've experienced everything you can experience, especially if you're physically well. But something that Dr. Lindsay said, and I have to touch on it now, we have a saying, and you've heard it before, but we use it a lot. Self-care is not selfish. And we haven't necessarily been trained as women, and especially, I have to say, women of color, because I'm one. We have been given that you're strong, you can do anything, just, buck up, and all of that's great. Except at some point, we have to take care of ourselves. I have a 2-year-old grandchild, so with my daughter, one of my daughters. And absolutely, I watch everything that's going on. If she's feeling like things are getting to be overwhelming, and you don't have to be underprivileged or a lower level of socioeconomic standing to feel overwhelmed. You can feel overwhelmed with a nanny in the house because it's all a part of how you're feeling as a unique individual. And if you have had some previous depression, you might not have even known it. You might not have even known that it was depression, because everyone has good days. And things can happen where a person can have a bad day. You can't say, well, I'm depressed about that. And that's why FASA came into existence, so we could bring people in, like the people in this particular webinar, who can help other people recognize what's going on with the people around them. So we don't necessarily have a lot of information for the moms. We also have information for the caregivers so that they can pay attention. We wish that we had some sign, some indication, but we just want to make sure that if we can, another family doesn't feel what we felt.
Real quick, Ms. Smith, so when you refer the mothers to different programs, do you follow up with them afterwards to see how they're doing, or is it just that you just refer them and that's it?
No, we follow up with our newsletters and updates, and we also and through email, but we simply let them know we're here, because we don't take any personal information from them.
Okay.
But we follow up with our resources.
Okay, gotcha.
So we follow up to see, what's going on as far as our resources are concerned, because they're ours. So someone can come into our organization and say, well, I'm a therapist and I like this particular area and I want to be in your directory. But we build a relationship with that therapist. We build a relationship with that counselor, and they build a relationship with us. So if someone comes through FASA in our brief and very surface intake process, because we do have their email address, and if they provide their telephone number, our main thing is safe. Do you feel safe? And do you feel like you want to take that next step? And of course, if we have a therapist that's charging, all of our resources have some free inlet. They have a webinar, or they have a weekly group meeting. Even our hypnotherapists, they have something that they can offer that costs nothing for you to learn more. But if the mother does want to get a couple of sessions, then we try to come in and finance that as well.
Okay, we talked about access to healthcare. Ms. Rita, I want to talk a moment about barriers in terms of having access to healthcare. One of the things that I've seen firsthand, working with clients in the mental health field, for example, you have clients that have Medicaid. And because they have Medicaid, there are a lot of dentists who don't accept Medicaid. So therefore, their dental needs may be neglected. I mean, you got places like Henrietta Medical Johnson Center, Westside Health, and Pierre Toussaint who do a pay scale or whatever type of based on your income. However, the way that the economy is, if someone's getting a monthly check, gas prices going up, food going up, man, they might not be able to pay a sliding fee scale to see a dentist. So therefore, their dental needs are neglected. And then, as of recently, maybe about a year or two ago, there are some eye doctors who used to accept Medicaid, but now some of the eye doctors don't accept Medicaid. So now their vision is being neglected because Medicaid is not accepted. So I know you work with the state of Delaware, so I'm not sure if there's any programs that can assist those who are rejected because their insurance don't allow them to see a dentist or eye doctor.
And it's a multifaceted. It's not just one issue. They're all interconnected. And I'm so happy, Mr. Omar, that you brought up the correlation between oral health and just physical health, as well as eye care. It's all connected to the body. And sometimes, depending on, diabetes for one, right? The impact on vision, if you don't take care of that. And so from the Medicaid perspective in Delaware, even when President Obama signed the Affordable Care Act, and part of what that legislation was to do was to expand Medicaid in all states. That was found unconstitutional by the Supreme Court, but Delaware's already ahead. Actually, under Governor Carper back in the 90s, he had already expanded Medicaid, and then under the Affordable Care Act, we expanded it even further. But then you get to the issue of access. So even sometimes you think that you've solved a problem because of the insurance would be available, and that was the premise and promise of the Affordable Care Act. If you don't have access to the practitioners, you're not going to get the care that you need. And it's interesting that you brought up dental care, because there is an effort right now actually to expand in Delaware the ability for new dentists to come in and practice. It's sort of a restricted market right now with access to become a dentist here in Delaware. You have to do a year's worth of residency and pass the test, even if you've already have a dental license in another state. So when you look at it from a market-based opportunity, it's really restricted. And then you look on top of it, the Medicaid population, and that rate of reimbursement might not be the same as if you're paying out of pocket, or if you have the privilege of having dental insurance, right? So if you have a limited supply, who is that supply going to go to? It's not going to be people who are experiencing poverty. And then to your point, it just compounds this issue even more relative to getting healthy nutrition. And when Dr. Lindsay talked about, when you had the discussion about COVID and you were talking about stress, I kept thinking of those cortisol hormones that were pumping through your body, that stress hormone, that it's fight, flight, or freeze. And if you're going through that high level of stress, we know what happens to the immune system. So what's fascinating to me, and even Ms. Smith, when you were talking about, women with postpartum depression, when you think about hormonally what's going on, right? So like just your hormones are they're just running wild, right? And for some women, it may not be as intense as for others. So the body, we can't fragment these things. It always amazed me that we fragmented behavioral health, or we fragment oral health, or we fragment vision health. It's all part of the same body. And that's why looking at holistic health and ensuring, what people are up against, but access, like that cannot be diminished. And Mr. Omar, you just hit it with so in Delaware, the legislative branch has expanded dental care to adults under Medicaid. However, there's no dentist to serve them. And so looking at that, that's why they're looking at passing legislation that would open up that market a little bit more intentionally than what it is right now. The other legislative initiative that is going on is also expanding healthcare to individuals who are non-citizens here in Delaware. Delaware does have, it's called the VIP program, where doctors will provide access at a less of a charge. But we also know Delaware and across our country, we're becoming more diverse all the time. But we have people here that aren't legal citizens that, again, have extreme barriers to getting healthcare. And, you know, healthcare is a public good, right? So if people aren't accessing healthcare, and just think of a contagious virus like pandemic or other viruses, it impacts all of us. So we need to look at all of those issues. And Delaware's small enough that I think we can be very creative in coming up with meaningful solutions. But, you know, it still amazes me. There's a little community down in Sussex County called New Hope. It's close to Ellendale. They have no drinking water. No drinking water in Delaware. It's like a third world country. And we were able, through my partnership, to work with the Food Industry Council and the Beverage Council. Now, Sussex County is trying to build that infrastructure so that they can get safe drinking water, but that's been 2 years coming. And the Food Industry Council and the Beverage Council actually gave me funding to get bottled water delivered into that small, impoverished community. But for me to hear in my own state that there's people that do not have access to safe drinking water, a basic public health, right? Like we all need safe drinking water. I was just like appalled that right in our own little state. And I'm sure there's other pockets in our state that are facing the same thing. And that's why, you know, we really need to look at access, but really zoning in on these communities that have been made marginalized, because it's not a level playing field by any regard.
Right. All right, ladies. So we're coming to a close to our program. So I want to give each and every one of you an opportunity for closing comments. Dr. Lindsay, Dale Healthcare, just remind individuals who are watching, you provide medical services, and I believe you're still working on getting the dentist, if I stand corrected. Why don't you tell people where your location is and what is it that you exactly do there once again?
Okay, sure. Again, thank you so much. So again, we are here, our absolute goal is to serve the marginalized, the underserved communities. We identified that there's a lot of work to be done. We know it takes everyone. And so we just we came here again to create that space for our individuals. All individuals who need care, we're taking new patients. We are located at 2801 Lancaster Avenue. You can find us at delcarehealth.com. You can follow us on Facebook. We're on Instagram, we're on LinkedIn. Our intention is the intention when we got here still is, we provide holistic care because we're nurse practitioners, right? And I like to brag about nurse practitioners. We provide holistic care. And so here, what we do, we create, like I said, our intention was to create that space. So we have, currently we have an in-house lab. We are connected directly to LabCorp. So once the patients come in, they don't have to worry about a day off to go to LabCorp. You can get your blood draws right here. We have an inpatient dental space that we have. And like, there's a struggle for dentists. We have been in touch with this one gentleman who is willing to give us 1 day every 3 weeks. So we are working feverishly, and hopefully that will come on stream maybe around June or July. The intention is to provide that care that the individuals need under the one umbrella. We are also looking to do CPR classes so we can assist the young people in the area to get the certifications they need to move, to stay in the working world. Again, we're here to serve the community in every aspect that we can. And so we are trying to identify the need where we have identified, we continue to unfold different things. And the goal is just to continue to work in every aspect to provide holistic care. The goal in the upcoming weeks is to start having, now that we're beginning the restrictions have lifted some, We are looking to do diabetic classes in the evenings with a small group, just so we can, again, create that space where individuals can talk about. And Miss Johnson, we will be calling you for your expertise.
Absolutely.
So we try to find resources that are available. Our office manager, Miss Angela Carpenter, she's superb. She's absolutely fantastic. She is like our go-to machine. She's a computer on her two legs. And she has worked in healthcare for over 30 years, and she's able to look for resources. So we have that. If there's a patient out there who do not have insurance, we have a sliding scale here for you. So you can pay based on your income. We decided when we came here, business partner and I, that no one will ever leave our doors. You will not exit unless you get care. You will get care. You will walk in here and we will work with you, because the goal is to ensure that you get care. We try to look for, again, talk to LabCorp to see what discounts they can offer. Again, we're here to serve the public. We want to, provide you with that holistic care that you so deserve. And if there's any organizations out there and the wonderful panelists here, please let us work together. The goal at the end of the day is to build healthy communities. But how do we do this? We have to be able to identify the needs of each individual and be willing to, again, meet them where they are, work with them to address their needs, because we do understand the challenges that the underserved, especially the underserved community face. Again, so let us just unite, try to work with these individuals, try to create comfortable space where safety and patient-centeredness is front and center. Again, we are on Lancaster Avenue, 2801. You can find us anywhere on social media where we try to be hip. we're everywhere. Again, thank you, Mr. Rashada, for having me. Thank you, ladies, on the panel. I'm so happy to be among this wonderful group of ladies who have their expertise to offer. Again, let us just unite, try to work with the community, try to help to build stronger communities, because then by building stronger communities, we build much healthier societies.
Okay, Ms. Smith, how can people get in contact with FASA?
Well, once again, thank you so much. I echo everything that Dr. Lindsay said. And FASA can be reached at FASA, that's F as in Frank, OZA, Inc.org. And we, of course, try to reach out. We want you to connect in every way, so you can also find us. And we try to keep our name consistent. So if you put in FASA Inc. in Instagram, will come up. If you put it in Facebook, it'll come up. If you put it in LinkedIn, any of those will come up. And the main thing that we're looking at right now, like I said, is like Professor Langraf said, that is legislative. What's happening on the legislative area? We're a small organization, but we work with larger organizations. We're working with 3 right now. And tomorrow, those virtual conferences will be going on with 33 senators or their staff members. And this is put together so that there will be, and I just want to make sure that I say what it is. We'll be talking about funding existing programs, because there are programs out there that can be funded. You'll see maps of some of the monies that have been collected in the millions of dollars, and the states that have actually put in for some of those funds and did not get them. Of the states that have put in for them and did get them, you'll be able to see those numbers breaking down. We'll be talking about authorizing those existing programs and addressing the inequities and the disparities that are going on with Black and brown women. Like I said, triple the numbers of negative outcomes compared to anything that's going on anywhere around them. So 1 in 5 women will have a negative experience with postpartum depression. And that is just nationwide, 2 in 5 or 3 in 5 with women of color. So that's a huge disparity. And so we'll be talking about that. And just wanting to, once again, thank you, Omar. I know, if your zip code comes into our system, you know that you'll be speaking to me or one of my staff members personally. Thank you so much. And just for this whole platform of opening it up for Women's History Month.
Okay, Ms. Rita, how can people contact you at the University of Delaware program?
Okay, so I'm again at the University of Delaware. You can just Google on the Partnership for Healthy Communities, and we will be there. And such an honor to be with all of you this evening and learn from you. And I think we could all come back together and continue with the strategies. Dr. Lindsay, you need to testify on that dental bill and talk about like what your vision is, because I think that might get us over the edge there and get that thing passed so we can get more dentists. But all of you are just tremendous in you know, your own individual roles. But again, that idea of that village, if we all come together and apply our investments and our resources, we can really eliminate these inequities that are causing these disparities. It won't happen overnight. It didn't happen overnight that we got to this level, but I feel a real strong commitment that we can unify and move this forward. And a state as small as Delaware, we can get that done. So
Right.
thank you, Mr. Omar.
All right, you're welcome. You're welcome. Okay, Oshay, before you close out, is organic the way to go? Should we eat more organic? And then any closing comments?
No, not waste more money paying for organic food. They're the same as your regular food.
Okay.
And I know that many of you know, I've already reached out to you on LinkedIn. So
Yes.
thank you so much, Rosie. Thank you so much for that comeback. I've connected with all of you, and you can connect back with me. Love you all.
I would love.
Okay, Oshay, how can people get in contact with you?
Yes, absolutely.
So I was there. I'm sorry.
Okay, Oshay, how can people get in contact with you?
Instagram's probably the best way. I am planning to go into private practice this year. So you can follow me on Instagram at the Zen Dietitian. My goal is to start by this summer. So I'm trying to work with insurance companies and finalize everything. So I would love to work with all of you ladies in any way, capacity. I am very big into community nutrition. That's how I got my start in nutrition, was more so serving underserved communities and populations. And I would love nothing more than to get back into that in terms of also serving moms, caregivers, going into primary care. So I think there are definitely partnerships all of us can make for sure.
That's awesome. That's awesome. All right, ladies and gentlemen, thank you for tuning in for tonight. Next Tuesday at 7 o'clock on Showtime TV Facebook page, I'm going to be interviewing Women in the Arts. That'll be part 3. So ladies, I'd like to thank you all for coming on. For those who are watching, please like, subscribe, and share. Now we got to do this again.
Thank you.
Ladies,
Thank you.
Bye.
Thanks, everyone.
See
Bye.
you all soon.
all right, thank you. Happy Women's History Month, ladies.
Thank you.
Thank you.
Thank you.
Thank
No
you,
problem.
ladies. Have a good one.
Bye.